It's March 24, Ukraine Media Center Ukraine Forum continues its operation. My name is Vasil Samokhvalov and we start our next briefing. It's dedicated first of all to today's date. Today is the Global Day of Tuberculosis Awareness. It's a dangerous illness. Ukraine was quite successful in countering it before the war at least, but now we all realize that the war started and there are consequences. I'm talking about the internal displacement and the prevention measures degraded to the areas of active warfare where the soldiers live in conditions of high humidity, in cold, very uncomfortable conditions, and it results in a lot of problems. And the challenge is such that we will probably see the growth of tuberculosis cases in Ukraine. We will talk to Ihor Kuzin, Deputy Minister of Health of Ukraine, Chief State Sanitary Dr. Yana Terleieva, Head of the Tuberculosis Prevention and Control Department of the Public Health Center, Natalia Husak, Head of the National Health Service of Ukraine, and Olha Klymenko, Chair of TBpeopleUkraine charity organization and Chair of the Steering Committee at Stop Tuberculosis Ukraine Partnership. Miss Ihor, what's the situation for the time being? Has it become worse? Yes or no? What should we do in this case? Well, I would like to avail myself of opportunity to say a couple more words. I want to say that tuberculosis is kind of disease that really is by our side within since that period, since that moment when the science started documenting any diseases at all, and everything was made in the world, so the world has efficient instruments, efficient medicines and diagnostic equipment. Wars, social maladies, they only increase the number of tuberculosis cases, but at the same time we should not forget that tuberculosis is something that has some remote consequences. For example, for the time being, we document that about 20% of the Ukrainian population feel some deficit of medical assistance related to the fact that they don't address their family doctors for examination, or have the status of internally displaced persons and they got different priorities, for example. But in all those cases, all those undiagnosed cases, this is something that we will see as the time passes. And even now that we don't observe any significant growth of cases for the time being, but due to this clandestine component, we will witness the growth of cases after the war is over, when all the territories are coming back to Ukraine, are deoccupied. The diagnostics will be reestablished there too, and this is when we will see all those cases. Unfortunately, they are now below the recommended level, the level recommended by International World Health Organization. There is a vaccine available, it should be done. Their recommendation is to have 95% vaccinated. So for the time being, we have to say that the problem of tuberculosis doesn't lose its urgency, and now maybe each and every one of us should think whether we have any tuberculosis symptoms. If so, we should address the family doctor and undergo diagnostics and receive treatment if necessary. What are the symptoms? Is the fever, like a minor fever, cough, tiredness, and this condition should persist for at least 2 weeks or more. If you have such symptoms, you should address your family doctor. And I would also like to debunk maybe a myth that now we use very highly sensitive methods of tuberculosis detection. If before that we had to wait for some time before we know the results of our tests, now we use the molecular methods in the same way that we use for diagnosing COVID. Those systems are called GenExpert systems, and they allow diagnosing tuberculosis in the prompt manner. On the very next day, a patient may obtain a result of the test already, and if it is positive, then the anti-tuberculosis service will get engaged for the treatment. As to the treatment, I would also like to add that obviously tuberculosis in imagination of our people is being treated for a year, sometimes two, in hospital conditions. It's very difficult with a lot of secondary consequences. Well, it's not so. Ukraine is moving towards European Union, and we track the world tendencies, specifically in protocols of diagnosing and treatment of tuberculosis, and Ukraine is the first country in Europe which, upon the publishing of European tuberculosis treatment recommendations, already adopted them in the Ministry of Health of Ukraine, and the medicines used in Ukraine, they are recognized in the world, they are efficient, and they allow us to reduce the period of treatment of the patients. And within the last 5 to 10 years, a lot of changes have taken place, and my colleagues may tell you about this in detail. There is no shortage of medicines. No, there is no shortage, no deficit of medicines. There is a buffer, a proper reserve, and availing myself of opportunity, I would like to thank our donor partners, because now it happens at cost of a global fund, and the government keeps procuring those innovative medicines and diagnostic devices, and this support from the global fund, it was announced in the first quarter of this year. The Global Fund allocated at least $59 million for support of Ukraine so it fights tuberculosis efficiently. Those funds will be made available since the 1st January 2024, and they will be purposed for years 25 and 26. Thank you, Yana Terleieva, head of the Tuberculosis Prevention and Control Department of the Public Health Center. So what was the situation now? What are the models? What are the forecasts? How it would be able to develop? Well, first of all, thank you for this opportunity to draw attention to such an important issue as countering tuberculosis, specifically under conditions of war. So we're fighting for life and health of every Ukrainian. So first of all, we have to identify what's the number of people who have tuberculosis in their lives now. So according to our details, more than 15,500 persons contracted tuberculosis. Now, if we measure it in lives, it's too much, but from the vantage point of epidemics, there is no epidemics in Ukraine. However, we hear such myths sometimes. For what period? It's for the period of the year since the beginning of year 2022, and we emphasize that the situation is quite tense, it's quite difficult, but at the same time there are certain achievements. If we say how the trends are changing in regard of tuberculosis, we have growth of cases 2.5% compared to the last year. It is a result of the war, maybe insignificant, but still it is existent. Then there were a couple of waves of mobilization. Well, tuberculosis usually affects men of the capable age, and such cases were identified during medical commissions before enlistment. So a large part of those regions which were under occupation, after liberation of those areas, the people addressed for medical assistance, for medical help, and they were identified as those who contracted tuberculosis. On other hand, we were taking a lot of efforts on expansion of diagnostic facilities, diagnostic capabilities. So we applied modern methods of tuberculosis detection, and the work of our teams, regional teams and government teams, it shows some results already. So I can say it's certain success, it's an achievement and the result of our work even under the conditions of the war. So comparing to the figures from years 20 and 21, COVID influenced detection of tuberculosis cases a lot. We under-detected about 30% of those who are ill with tuberculosis. So application of those new approaches will allow us identify those who were left beyond the healthcare system recently. When we expect the situation with tuberculosis to deteriorate, we see that tuberculosis is a problem that we were not able to overcome within thousands of years, and it's not something like COVID. COVID is highly contagious. On the contrary, tuberculosis develops very slowly, and it is influenced by a lot of factors like the condition of immune system and economic indicators and continuation of contact with the person who contracted tuberculosis. So the negative influence of the war will be felt maybe not this year, not the next year, and maybe after years. And again, it will depend on how long the war will continue, but after all, we are ready to accept any challenges. Just like Mr. Ihor mentioned, we have a new standard for medical assistance, medical help. This is the Order 106 that will allow us to keep the situation with tuberculosis under control. So now we don't do the microscopic study of the mucus to diagnose tuberculosis. We use the molecular genetic systems to diagnose tuberculosis. It's 327 such systems of Ukraine. It's our achievement when such systems were acquired with the support of the donors, so we can provide better access to the people with tuberculosis. So diagnostics is free, it takes just a couple of hours, and we don't only detect tuberculosis as it is, but we detect the persistent form, because Ukraine belongs to countries with where the forms resistant to treatment are quite widespread. Also, we have new capabilities to identify tuberculosis in children. That's a very sensitive category, and every year we underdetect tuberculosis in children at least twice. So we want to call all the parents to pay attention to the symptoms if their kids have any. What's new? We can identify tuberculosis, we can detect tuberculosis with kids upon study of their feces. It's difficult to obtain mucus from children sometimes, so these new systems allow us to detect it in feces. As to the treatment, we have quite a broad capacities now. People can get themselves treated in a more safe manner, in more efficient manner now, and our country last year became the first country to implement the new innovative regimes in operation study. There is the new medicine pritamanid, which was developed within the last 50 years, is the treatment regime which is really a salvation, because even the patients with the heaviest forms of tuberculosis, with very resistant forms, they can undergo treatment within 6 months, and more than a year ago such treatment could take a year or 2 years. So this medicine is now available, and the government allocated funds for it, we are provided with it 100%. Also, the opportunities changed for the people with resistant and sensitive tuberculosis. Their treatment now takes less than 4 months. So under these conditions of war, it's very important because we can stop spreading of the disease with this new treatment. Also, the new standard clearly describes that now the human-oriented models of treatment are the preferential models, and now the major part of children with tuberculosis can visit schools and kindergartens while being treated. There is a very limited category of population who should be isolated. So it's the fundamental of our new approach, and we want people who have tuberculosis to feel this support from the society, because unfortunately now we all know about the cases of stigmatization of tuberculosis, and this is something that makes people conceal their disease because they are afraid to disclose their diagnosis. So our task is not only to draw attention to the problem of tuberculosis, but to change the attitude in our country, because it's curable, and the international slogan says that yes, we can stop tuberculosis, and we confidently say that in a team like this we can stop tuberculosis, and journalists and everybody who is by our side and on the other side of the screen, you can get engaged to bring this moment closer, because the war brings us further in time from this moment of liquidation of tuberculosis. Thank you very much. National Health Service of Ukraine, which is represented by Tatiana Boyka. Well, to summarize the statements of the previous speakers, we have all the packages of medical services and the medical services that are included in those packages that we use to bring this aid closer to the patients. It's been 2 years that one package is already working, when the patients after stationary treatment, they have the confirmation, they have the confirmation upon the test that they can switch to home treatment, ambulatory treatment. There are 511 institutions in our system which keep working in Ukraine, even in those regions where active battles are going on. We have contracted institutions. The total amount of contract is over 6 million hryvnias. The tariff paid by us is 835 hryvnia. During the last month of treatment, this amount is multiplied twice, so it's a stimulating tariff. And if we talk about the stationary treatment, there is one medical institution per region that is being contracted for such treatment, and upon such treatment we already paid out 56 million hryvnias for treatment of patients in stationary conditions. So we bring this aid closer to the patients, and to find such support, the patients may use the website of the National Health Service of Ukraine or apply to hotline 1676. You may find out the address. You may find the address of a medical facility which specializes in such treatment, or the other healthcare facilities which are contracted by us. Or if a person receives medical support in one region and then they move to another region, we use the extraterritorial principle, so they may use our services in other regions too. This medical aid is brought the most close to the patient possible, so they can receive all the medical services where they feel necessary. Thank you. Thank you, Olha Klymenko, chair of the TBpeopleUkraine charity organization. Thank you for gathering here to discuss this important topic. We represent the interests of the patients, of the people who were affected by this problem of tuberculosis, and I want to say that the war became an important challenge for us. A lot of people immigrated since the beginning of the war, and the task of the government and the civil organization was to support people, because people, while staying abroad, usually were afraid to talk about their disease, about their medical condition, that they were requiring the constant medical assistance, and we had to take some colossal efforts to make sure that the war doesn't take away those lives that we were fighting for during peace time, and using a joint effort we made it. And the one thing that, in my opinion, is still we have not achieved is the discrimination. People with tuberculosis who are in our society, when we don't talk about their staying in the hospitals, but about some people who are among us, how tolerant and sensitive are we to their conditions, because the war is the stress and fright for everybody. But when you are somebody who has this disease, you feel it more sharply. You need support, you need information, you have to find your inner strength, so that during difficult time like this you are a support to someone else, because social barriers like the monitoring shows, all the measures that we implement in Ukraine, and with even with the financing of Global Fund, who extend maximum support to Ukraine, so we don't lose this momentum of achievements by our country. In the medical institutions, we installed the info boxes that are the virtual assistant to the diseased, to the ill persons. They can make use of this virtual assistant to they may use the information about the location of the medical institutions and the services they can make use of, and people may use the hotline. It doesn't require a telephone or additional funds. It's easy for any person of any social financial category. Those people will be picked up. That network will be arranged across the territory of Ukraine, and there are info boxes outside Ukraine too. And this is how we were able to create this network, in which we try to focus on the problems of people with tuberculosis. They still require our support until that very moment when the government will start providing people socially and financially in complex. That would be possible only after the war, but for the time being, well, I believe it will be possible. We have ambitious goals to overcome tuberculosis in the world by 2030. Now that tuberculosis is curable, more than 4,500 people die on a daily basis throughout the world. Tuberculosis doesn't pick by social or financial conditions. It's universal, but we do everything that we can to give this clear breath to our children, the breath without tuberculosis. And the journalists play an important role in that. You are the front line in front of the civil society, who use their resources to deliver, to communicate the information. So we issued the guide how to talk about tuberculosis without discrimination, because sometimes the terminology hurts more than the illness itself. The change of perception may save a lot of people today. Every saved life of a person whose rights were not violated is our joint victory. And I wish everybody to live in the tolerant environment, and we overcome tuberculosis in Ukraine and in the world. Our fight is going on not since the 24th of February, but on a daily basis. Every day we keep fighting. There is the tuberculosis agency established in Ukraine. Regardless of the war, we keep working so people continue being able to receive good, proper support, good medical aid, and to have those achievements of the government and the non-government organizations, so that they continue. So when the war is over, we can continue receiving high quality support, high quality help, and to have the tuberculosis, to make it not something beyond our reality, but that is something, a part of our world that we are about to overcome, and it goes back in history. Thank you for your attention. Thank you. I have a couple of questions, and then we will proceed to the questions from the floor. So if we're talking about the growth of cases 2.5%, how does it correlate with the population in absolute figures? We know that a lot of people left abroad, so how does it correlate with the number of detected cases per 1,000 or per 10,000 people? Because 2.5%, in view of the fact that the population of the country reduced, it doesn't tell us a lot. Well, first of all, we were very worried because we all remember that the enemy was destroying the infrastructure. The medics did not have access to electricity for weeks. But today our statistics is being gathered in the electronic systems, and all of that created prerequisites for us to lose the statistics. So we don't understand what's going on with the level of contraction and disease. So regardless of all the complications, regardless of the reduction of number of medics, because the majority of the western regions, the central regions, they received the major part of the internally displaced persons, among which we also detected the cases of tuberculosis. And under conditions like this, I am proud to say about the tuberculosis service that we've taken a lot of efforts to have every case of tuberculosis, every story of every person to be added to those electronic databases. And in the scale of the country, we were able to make it. We show data in Donetsk, Luhansk, and Kherson region, and when we were asking about Kherson region how they were able to make it, so one of the examples, for example, Miss Natalia, who was responsible for gathering the statistics, she spent 9 months in occupied Kherson. She was finding an apartment block where, well, she had to climb a ladder and to catch the signal somehow, and so she was taking pictures of those details and sending them to another region where they had access to the electronic databases. So this is how the medics now work with diligence, and they try to spread information about tuberculosis. So getting back to the first part of the question, yes, we were able to preserve the statistics, and it is in accord with the tendencies that reflect the overall situation in the country. Secondly, how faithful the statistic details are. We provide external supervision in cooperation with the World Health Organization. There is a system of proper verification, and we know now that our statistics is verified, and we may trust it. Its efficiency is proved by our partners from World Health Organization. And next part of my answer is that there is certain dimension of statistics evaluation. The statistics is evaluated by 100,000 population, so per 100,000 people we detected that number of people with tuberculosis that I mentioned. But we have to remember that there are people who remain under occupation, part of Donetsk, Lugansk and Kherson region. We don't know what's going on there, to what extent do they have the access to medical services, to the modern models and standards as we have here in Ukraine. It's a question for us. We only have the preliminary calculations for the people, only the estimates as to the number of people who remain there, so we draw the attention of such organizations who have influence on the terrorist countries, so that they take care, they make sure that the Ukrainians who end up in the temporarily occupied territories have access to high standard medical services, because tuberculosis has no borders and it may have consequences not only for European Union but for the whole world. Another question is about the target audience and the zones of risks. You mentioned that the target audience is the men. For example, previously the zone of risk were the imprisoned, incarcerated ones. Now the zone of risk is the army, the armed forces of Ukraine. What's your cooperation with the armed forces of Ukraine in terms of prevention and examination? Well, I would probably start with the cooperation. Obviously, cooperation with the armed forces is quite active, not only in terms of tuberculosis, but other infectious diseases as well. And it is as follows. The relevant departments in the armed forces, they keep control of the epidemic situation, and they have all the information, and they are those who make decisions on the medical support. There is constant contact with medical support department, but what specifically is done in that regard? First of all, the armed forces use the mechanism of mobile teams, which are capable of examination in field conditions to diagnose tuberculosis. They can do X-ray in non-stationary conditions. The armed forces receive diagnostic devices. They receive treatment either in civil sector or based on the military medical institutions. In case of necessity, they have the same level of access as the civil population. We just need to expedite the process, in my opinion. Some cohorts, as they are being prepared, they have to undergo those screening examinations on a regular basis, so we don't omit any cases of tuberculosis. Do you have anything to add? Well, regarding the zone of risk, it's not an easy question, because we all understand that more than a year each of us is under constant stress. The majority of population of Ukraine goes down to the shelters due to the missile strikes. We see the level of inflation, and we understand that those are the factors that potentially influence the spreading of tuberculosis. And now maybe it's every Ukrainian who is in the risk zone, including those who live abroad. But there are traditional groups of people who have higher chances of contracting tuberculosis, like social groups, medical groups, and they are defined in the standard for medical support that we mentioned. I will name only a few of them. First of all, those are the people with whose immune system is weakened. So those who are treated different tumors, who are infected with HIV, who have chronic diseases of lungs, silicosis, who are preparing for transplantation of organs, and our task and the task of the family doctors to systemically remind their patients with whom they enter into the declarations to get examined for tuberculosis. It's quite easy. There is a screening questionnaire where you can answer the basic questions within 5 minutes. The cough within 2 weeks, minor fever, sweating, and upon such screening the people are either forwarded for a chest x-ray, or if there is a cough, for molecular test on the gen expert systems. So those who end up in the risk groups, they should know it, and if the family doctor doesn't call you for such examination, you should address them by yourself to get examined for tuberculosis. Well, we had problems now when not everybody is taking care of their health, so it's about time you start taking care about your health, because we all expect for the victory and we need our resources to renew the country. Thank you. Questions from the floor. Good afternoon. Ukrinform, Olha Klymenko. Can you please tell us if you can provide any practical advice? What are the steps to be taken by the people who know that they already contracted tuberculosis but still they leave their homes due to war? And for those who live abroad, and maybe you have any details about the people who suspended their treatment due to war, and what is necessary to renew such treatment?
Буквально в перші дні війни ми зрозуміли, що буде
Just within the first days of the war, we've realized that there would be mass migration inside the country and abroad. So the first thing we've done is we got in touch with the World Health Organization to arrange connections with all the countries where Ukrainians would potentially go. So first of all, we were talking about those countries who received the majority of Ukrainian refugees: Poland, Germany, Hungary, Romania, Slovakia. Those are the countries which received a major part of Ukrainians and respectively major part of Ukrainians with tuberculosis. And I appreciate all the efforts taken by the WHO and the governments of the countries. We exchange data with them. It's more than 40 countries now. I appreciate their colossal job. There were safe systems, secure systems created where we could communicate in any language to hand over the details of each and every patient, what is necessary to be known for those medical systems of the countries who were receiving our patients with tuberculosis. But because now the major issue is the security of patients' data, we understand that patients have right to have their personal details secured. Where medics were unable to provide such information to us, there was a misconnection. The connection was cut. The information could not be communicated to us. So anyway, we know about 300 such patients who moved to other countries with tuberculosis. This is whom we know about. Unfortunately, some patients, they had to suspend their treatment, so while moving to other countries, their health condition was not always their priority. They had to rearrange their lives to understand how to move forward. There was certain level of depression, difficulties in acquisition of medical support, and it all resulted in suspension of treatment by some patients. For example, today we had a seminar with Polish side, and more than 90 patients ended up in Poland. The majority of such people already completed their treatment. Some part of those people, they already returned to Ukraine, but there are 30 patients being treated in Poland. They receive all the necessary medicines. And as to the system to of the registration and documenting of those persons moving across the country. The first thing that the National Medical Service has done is they decentralized this process. There are contacts of the all necessary medical institutions for National Health Service in every hospital, and I'm happy to report that regardless the shelling by the enemy of the medical infrastructure, in more than 10 regions we had losses of the medical infrastructure in terms of tuberculosis treatment. In more than 20 regions we were able to preserve the tuberculosis treatment system, which was quickly adapted to the modern realities. And for every internally displaced persons there is a mechanism. If a person doesn't have their anamnesis with them, the medics from different regions, they may exchange data, and my department helps medics to acquire such information in case they can do it themselves. So if people suspend their treatment to get treated, to get cured of tuberculosis, I call everybody to address the medical facilities now. Is the best chance to continue treatment now. All the contacts are available for transfer of patients' details, even about the patients who are abroad. Everything is available, and we will help each and everyone who applied. There are no exclusions for us. We will help you, we will assist you to get cured in any case. I just wanted to add a couple of words. If we're talking about the patient inside the country, they may apply to any medic who can found either online or through our hotline, and they don't need the electronic application. You can go without electronic application, without electronic prescription. Sorry. I also would like to add that migration is not only a stress, but is the language barriers and social challenges. So for the time being, in every country that Ms. Yana mentioned, there are NGOs that are ready to support people, to provide them with the necessary services that they were getting in Ukraine. Because when we started analyzing, there is certain difference between what people receive in Ukraine, I mean the support, and sometimes it's not the same support that they can receive abroad. So there is a platform called Help Now. You can apply there from any country, not only in case of tuberculosis, but for the HIV positive and people with their replacement therapy. And there are also facts that if due to any reasons you were not able to contact the medical services, just apply to an NGO or to our organization, and we will forward you to the relevant healthcare facility abroad. Thank you very much. For what I understand, we don't have any more questions on the floor, so let's wrap up. Well, it only proves how holistic was the information you provided. Thank you for telling us about the risks and how the Ukrainian medical system counters those risks, and we will continue our work on Monday. See you.